Hi, my name is Dr. Karl Yousef, and I'm here to break down what to expect in the emergency department when you come in with suspected stroke. I'll walk you through certain things your doctor may be thinking about, and afterwards, I'll explain certain labs or imaging that you might receive. Depending on the complaint, we'll finish with some potential outcomes to expect if your doctor sends you home. Remember, in the emergency department, we don't just look for what is going on, we look for what isn't going on. What does this mean? It means that as emergency doctors, we always have a mental list of scary diagnoses that we have to make sure are not happening to you. So, even if we don't find the exact diagnosis within one ER visit, our goal is always to rule out big, bad, and scary things. As you go through your workup, remember that even if you don't see your doctor for some time, they are always following your results in the background. So, you're coming into the emergency room because of a suspected stroke. When you come to the ER with a suspected stroke, your doctor will see you quickly. Usually, your ER doctor will do a series of physical exam tests to assess your stroke symptoms. Your doctor will also want to know the specific time your symptoms started. This will be important because it will help guide if certain interventions can be done, such as blood clot dissolving medications or other therapies performed during a stroke. You may find yourself taken to a CT scanner to quickly assess for issues such as bleeding in the brain or clots in certain arteries leading into the brain. If you are truly having a stroke and your symptoms are severe enough, and you are also within a 4.5 hour window, your doctor may discuss a medication with you that has a chance of dissolving the clot which is causing the stroke. Now, this medication is said to help roughly 33% or 1 out of every 3 people. However, around 5%, meaning 1 out of every 20 people, will also have a negative side effect from the medication, which is bleeding in the brain. Around 2% or 2 of every 100 people may die from the medication due to bleeding in the brain. This is always a tough decision to make, and your doctor, along with a neurologist, will help guide you and your family through this tough decision. If your doctor believes that you are not having a stroke, you may be experiencing a stroke mimic, which are certain conditions that can present with similar symptoms to a stroke. An example would be a condition called Bell's palsy, which can be a viral infection of the nerves affecting the face. Bell's palsy can cause someone to lose partial function of their face and appear as if they are having a stroke. Other conditions which can cause symptoms that look like a stroke include low blood sugar, seizures, and many other conditions. Your doctor will examine you and guide you through this process using their expertise and years of experience and education. You will very likely get blood work done in the emergency department, and you will likely also get a CT scan of the brain. After some time, your doctor will explain your results to you. If your doctor is recommending that you stay in the hospital, it could be for additional monitoring, or it could be that your doctor found something that needs extra attention. In either case, your doctor will explain to you the reason for keeping you in the hospital. Finally, if your symptoms improve and you're being sent home, I'm happy to hear that. Make sure to follow your doctor's recommendations, and if your symptoms are not improving or are getting worse at home, we always encourage you to come back to the emergency department to make sure nothing was missed on the first visit. I know that being in the emergency department can be an incredibly stressful experience, and I hope this is helpful for you. Again, this is Dr. Karl Yousef. Wherever you are, we care about you. We work hard to make sure that you're okay. While you wait, feel free to subscribe to this channel for more medical information from a board-certified emergency doctor. You can comment with video ideas that you want me to cover, and I'll take the time to reply to you. You can even watch some of the other videos on this channel for entertainment. Thank you for your time. I'm wishing you the best in your health.